Back, everybody. How can it not be devastating to learn that your child has cancer? But what lifts your spirits is to learn that a lot of kids actually do survive and that so much work is being done to minimize side effects of the treatment. To see an example of that, earlier this week, we visited the radiation oncology unit at Children's Hospital Los Angeles.
I did get depressed once or twice, but not like deeply depressed, just like this really sucks.
Darren Peng's medical odyssey began last October.
One day in English class, I was looking at the board and all of a sudden it was double vision and blurry vision and it wouldn't go away at all. So I went to an emergency room and I got a CT scan, and that night you have a brain tumor. And then the next morning I had brain surgery.
Darren's diagnosis, choriocarcinoma, a tumor with a high risk of spreading down his spine. After surgery, intense chemotherapy. Now he's undergoing what he hopes will be the last leg of his treatment, radiation.
We're trying to cure him, so we want to make sure that this tumor doesn't come back, but we also have to make sure that we give him as normal a life as we can.
The radiation oncology team at Children's Hospital Los Angeles is using a new tool called a linear accelerator. It delivers high-dosed, custom-shaped radiation beams to the tumors. The hope, less pain and nausea.
We also worry about producing a secondary cancer 20 and 30 years later. So, and all of these are risks that you think about when you treat adults, but tenfold when you treat children.
Normally, to keep radiation beams aimed precisely at their target, doctors screw the head to a frame. But radiation physicist Dr. Arthur Olsch devised a mouthpiece.
This is a custom dental impression.
It's molded to Darren's teeth and has a tiny hose on the palate. And when the vacuum is turned on,
their head is immobilized in all three dimensions.
Darren is now in his last week of treatment. He's brought his tunes and has chosen his favorite light show. He realizes all the bells and whistles aren't medically necessary, but believes they do make a difference.
I think so, because there's this giant machine here, like dangling over your head, spinning circles and messing with you. It gets a little scary, especially if I was a little younger.
Oh man, and there's the picture of Darren right now. And joining me from Children's Hospital Los Angeles, neuro-oncologist Dr. Jonathan Finley and Darren Peng. Darren, you got your cap on. Nice cap, I like it.
Thank you.
I'm going to ask you a question about your time in the hospital, but first I want to ask Dr. Finley. Doctor, why does this strike kids? Is it disproportionate to young people?
Not really. We don't understand exactly what causes cancer. Actually, we know a lot of things that don't cause cancer in general, and brain cancers. But brain cancer is more prevalent amongst children than it is amongst adults. It's the second most common type of cancer in children after leukemia.
Well, then I would wonder maybe if the parents blame themselves.
Well, often they do, but there's no need for it. In fact, inherited forms of brain cancer in children are very uncommon. They do rarely happen, but most of the time we simply don't know what causes it. It's not simply something that's inherited, and it's not something that's caught in the environment, either from an infection or a toxic waste or something like that.
So you can't change the incidence of brain cancer in kids, but you can change the treatment. Are you optimistic about what's happening with treatment?
Well, having focused the last 30 years on treating children with brain tumors, I can report that I'm still and ever increasingly optimistic because we have newer technologies, such as the ones you just saw with newer, finer radiation techniques that both improve our ability to attack the tumor, but at the same time critically spare the surrounding normal healthy tissues. But in addition to that, we have increasing new strategies of drug treatment, better state-of-the-art surgery to get in and out safely, and also our understanding of the biology of these tumors, their molecular makeup, is allowing us to begin to develop really targeted and almost personalized treatment strategies.
You know, Darren, if Dr. Finley was my doctor, he would be giving me hope because of his certainty. But I heard that you met somebody in the hospital named Zein.
Yeah, the first time I was hospitalized at CHLA, they gave me a roommate.
Yeah?
And this little man is just so uplifting. Every single time he's in pain, he cries, of course. But as soon as the pain goes away, he smiles. He goes play Connect 4. And he just never stops living because of his condition.
So now he's younger than you are.
He's 6 years old,
6 years old.
and with I think a far worse type of cancer than I do.
So what did he instill in you?
This doesn't end your world. It sucks, but it doesn't end your world.
How are you feeling?
Good. I'm
Yeah?
almost at the end, and things are looking good.
What about soccer?
I haven't played for a year and a half, so I don't know. But
Hey, if you can get through this, come on, you can get back in shape for soccer. Do you
Yeah.
want to play soccer again?
yes, but I don't know where or how. I'm gonna try.
Of course you will.
See what I mean about the certainty?
Yeah, it doesn't give me a choice. If I
Yeah,
say, if I say no, he's gonna smack me.
Now that's a different kind of treatment. Dr. Finley, Darren, thanks very much for being here, and just come back to us every time you turn a new corner. And would you let us come back and let us know how you're doing in a few months?
Yeah, of course.
All right, man. It's nice to meet you. Doctor, thanks very much.
Not at all. Not at all.